And continuing on the health front, ArchCare is one of the nation's largest and most dynamic Catholic healthcare systems, providing quality care to thousands of people of all faiths through its home, community-based, and residential care programs. Recently, the organization has been certified by the Great Place to Work Institute for its workplace culture. Now, sharing more information, we're pleased to have the Assistant Vice President of Learning Organizational Development at ArchCare, Chelsea Brock. And Chelsea, glad to have you. Good,
Hi, Darren. Thanks so much for having me.
good to see you back. And I just want to say, first of all, congratulations. I mean, it's a great honor to say that you have a great place to work certification. And for somebody who doesn't know that, what does that mean? Obviously, it sounds like what it sounds like, a great place to work.
Yeah. Great Place to Work is really the global authority who determines whether an organization has a great workplace culture, if they have satisfied employees, if they have a high level of leadership. Great Place to Work really starts with an anonymous organizational wide survey that's sent out to everyone, no matter what they do. And it's really assessing the quality of the employee experience. And that comes down to whether or not people feel respected within their organization, whether or not they feel that there's a high level of fairness, if there's credibility within the organization, if they feel camaraderie with those that they work with, and if they feel a high level of pride in the work that they do. So all of those things come together, create a score, and if an organization reaches a certain threshold, they become certified as a great place to work.
So for you, what is it like to have that honor of being a great place to work?
Yeah, we are incredibly proud to have gotten certified this last year. Really, what it means is, first of all, it elevates us as an employer of choice for potential candidates. But even more than that, it really shows that we listen to our employees, that we prioritize their needs and what they express to us, and really putting in the work to improve that experience year after year. And having a workforce that is satisfied, fulfilled, has a high level of trust in the people they work for, and has pride in what they do. Those people are able to provide the best level of care to those that they serve.
Chelsea, I mean, when you think about being a great place to work in a time when having a job and having a great place to work is really vital. I think that's every person's dream, right? I want to work in a good environment. Um, Talk to me more about your organization in terms of what you feel like you do in order to make that atmosphere comfortable for employees, because not every not every environment is a great environment for employees.
Yeah, there's so much knowledge that can be gained from this survey. We started our journey with our Great Place to Work back in 2019. That was our baseline year to really establish where we were and what we needed to work on. And every year since, we have created action plans to, assess what we need to work on and improve that experience for the employees. So in 2021, we had 7 programs that were certified as a great place to work, and in 2022, we became certified as an entire organization as a great place to work. So, for us, that's not the finish line. Every year getting certified is not even the finish line. It's continuous improvement for the employees, making sure that we are meeting their needs and improving that experience year after year after year going forward.
And for our viewers who are just joining us, Chelsea Brock is here talking about ArchCare and talking about a great place to work. And when you talk about ArchCare, for someone who may not be so familiar, break us down a little bit about the work that goes on in ArchCare.
Yeah, for those who have heard of us before, a lot of the time they think of our nursing homes, and that is a big part of what we do. We have 7 nursing homes, 2 on Staten Island, that's Carmel Richmond Nursing Home and Egger. Up in Rhinebeck, New York, we have Ferncliff Nursing Home. We also have 2 in Manhattan, Mary Manning Walsh Nursing Home and Terrence Cardinal Cook Healthcare Center. And we have 2 nursing homes in the Bronx, that's St. Vincent de Paul and Providence Rest. But in addition to that, we also provide, an incredible depth of services that go beyond that. We have assisted living, we have specialized care that focuses on Huntington's disease, for example, dementia, those with HIV and AIDS, children with developmental disabilities. We also have home care. So for those who need services provided to them in the home, such as from home health aides, personal care aides, nurses, that's also available. And in addition to that, we also have 3 healthcare plans. We have ArchCare Advantage, which is a Medicare Advantage plan that provides coverage to those living in long-term care settings. We have ArchCare Community Life, which is a managed long-term care plan that provides coverage to individuals with chronic conditions. And we also have a PACE program, that's ArchCare Senior Life. And we often refer to our PACE program as a nursing home without walls. So individuals with this coverage receive all of the same services they would if they were living in a nursing home, such as nursing services, physical, occupational, speech, recreational therapy, dietary services. They also receive transportation and home care. They get all of that while also being able to sleep in their beds, in their homes, in their communities at night.
So as we continue to move on a little bit further, I just want to talk to you a little bit more because when we talk about senior services in nursing home, one thing that comes to mind right off the bat is like COVID and how COVID really played an important part in, we heard what went on with nursing homes and things of that nature. How hard was it for you to really, keep the ship afloat, given the fact that we were going through some of the most turbulent times during this pandemic?
Yeah, a lot of the time when this first came out, you heard a lot of the hospitals being hit hard, but this was also something that was a big struggle for nursing homes. And our leadership jumped right on that boat. We started addressing this crisis right away before it even became, a big thing in the news. We had daily meetings assessing, where the risks were. We put together what we call protect teams. So we have specialized individuals who are focused on infection control and prevention in every single one of our programs. We do everything that really goes above and beyond what's required to make sure that everyone, both the employees and those that we care for, are as safe as possible.
And so for people who need more information, what do they do about accessing the work, whether it's work at ArchCare or the services that are provided?
Yeah, they can either go to our website at www.archcare.org, or they can call our care navigation line, which is 855-951-CARE.
All right. Well, thank you so much for being with us, Chelsea. I think it's a great opportunity to talk about finding a good place to work, which is ArchCare, as you're listed as a great place to work, but most importantly, the services that are being provided to our community. I want to thank you much for doing that and making sure that people are taken care of. Thanks much.
Thanks so much. Thanks for having me.
All righty. Well, as she mentioned, for more information, you can visit their website at archcare.org. And, of course, you can call them at 855-911-CARE. That's 855-951-CARE. And we encourage you to reach out. All righty. Don't go anywhere. We got more Open coming up. We'll be back right after this.